Um, I think since I've mentioned carboplatin and paclitaxel already more than once, I want to just briefly talk about some of the side effects that patients experience while on these treatments. I think the first thing to mention is that although there are side effects, they're actually mostly very well tolerated and often quite well managed. So although there is a list of side effects, most women only experience a small proportion of them, and mostly to a mild degree. There's, of course, those women who do get serious side effects, but it's very uncommon. I think the first thing to mention is all chemotherapy drugs can cause an element of fatigue, and certainly carboplatin and paclitaxel do the same. Usually the fatigue is manageable, but people do have to slow down and alter their lifestyle to accommodate the fatigue to some extent. This chemotherapy protocol can cause some nausea, and if in the rare cases can cause vomiting. Most of the time it is very well managed and prevented by appropriate anti-nausea medication, and your own doctor would prescribe that to you routinely. I always tell my patients that if they are vomiting, that they should call me because that's not an acceptable side effect and we can do better. And I think most oncologists in the country would feel the same way. So you should not vomit, although feeling a little bit queasy is common. There are other side effects that come along that affect different people to different extents. Some people feel a little bit achy in the muscles and joints. Often that's very mild and transient. Sometimes it is more noticeable, and there are medications that can help treat that or prevent it. So that's something to speak to your oncologist about if you find you're experiencing quite notable aches and pains. These drugs with time, especially the paclitaxel, can cause some damage to the nerves in the fingers and toes. And that's also something to discuss with your oncologist. Usually it is temporary and reversible. So there's always hope that that kind of symptom will get better with time. On this protocol, women do lose their hair, and it only takes one treatment to lose the hair. And almost all chemotherapy drugs that we use have the risk of causing infection. That risk is usually quite low, but I'm sure in speaking to your own oncologist, you've been told to watch out for fevers and chills, and if you experience fever usually of 38 degrees or 38.3 degrees Celsius or higher, you're to contact a physician or go to an emergency room. Usually no serious consequences come from the infection as long as patients get seen promptly and are treated with antibiotics promptly. It's very, very rare to have people get extremely ill as long as they are vigilant about being seen in the appropriate center for care. Okay, so that's just a little bit about carboplatin and paclitaxel and the common scenarios in which they're used. I just want to mention a little bit of new data. As far as I know, right now, it has not yet changed the way we're treating ovarian cancer. But it's possible as time goes on, some centers in Canada will consider modifying their treatment regimens. This data was just published in September of this year. It still uses carboplatin and paclitaxel. This study still used carboplatin and paclitaxel, but instead of giving it on the regular schedule, which is every 3 to 4 weeks, it changed the paclitaxel to a weekly schedule. This study compared the regular schedule to what they're now calling dose-dense chemotherapy. They're calling it dose-dense because The paclitaxel is weekly, meaning there are more doses throughout the treatment cycle. The total dose of the paclitaxel is also just a little bit higher than the standard treatment. This study basically showed that by increasing the density of the treatment, we're able to improve the time to cancer recurrence. So by changing the Taxol schedule to weekly, it seems that the cancer might stay away longer. There are a lot of questions about the benefits of this kind of treatment because, unfortunately, it's also associated with a few more side effects. And people are wondering if it's really any better than intraperitoneal chemo. And that study comparing the weekly Taxol to intraperitoneal chemo has not been done. And in addition to the weekly treatment being more toxic, there's also inconvenience because patients have to come to the cancer center on a weekly basis, which is certainly a factor when it comes to lifestyle. So this is some new data. It may not change what your doctor talks to you about at this point. However, it may change what we do in the future, especially as other studies come along looking at this concept. Okay, excuse me, please. I hope this settles down. I just want to switch gears now to what about treatment options when ovarian cancer recurs? Probably many of you are familiar with some of the statistics or have already experienced a recurrence of your cancer yourself. Unfortunately, that's one of the challenges of treating ovarian cancer, is that we know that many women may experience a recurrence of the cancer in the future. There are generally two questions that a doctor might ask when a recurrence of ovarian cancer has occurred. The first would be, how long has it been since the cancer was first treated with surgery and carboplatin paclitaxel? That's basically an approach used to determine if the cancer is likely to still be sensitive to carboplatin and paclitaxel, but in particular to carboplatin. If it's been, most cancer centers use the cutoff time of 6 months. If it's been at least 6 months since the last treatment, then we feel that most people would benefit from treatment with carboplatin. Again, sometimes just carboplatin by itself, sometimes a combination of carboplatin and paclitaxel once again, and sometimes a different combination could be offered. One would be carboplatin and another drug called gemcitabine. And the final option which may be offered is carboplatin and a drug called Calyx. I'll just spell Calyx. It's C-A-E-L-Y-X.